Hi, welcome to another episode of Just Saying with. And in this episode, we're going to be with Dr. Warren Jordan from Orchard Health Clinic, who's going to talk to us about chiropractic care. Hi, Warren.
Hey Zed, thanks for having me.
Hey, thanks for coming on this episode. Um, you know, chiropractic care, I think there are a lot of myths around it. I myself never quite, I've heard about it quite a bit, but I myself never quite experienced it until I myself came down to Orchard Health. And so thank you for that. Um, but, maybe let's just jump right into it. What does a chiropractor do? And what can people expect? Or how is it different from, say, physiotherapy or, what do you expect when you go to a traditional Chinese medicine practitioner?
Sure, it's a good question. Chiro has been around for about 130 years. So compared to physio, compared to TCM, it's certainly a fairly new uh, profession. But I think the biggest focus really is about helping the body move and function in the way that it was designed to. People sort of have this understanding or preconception that we're talking about the cracking part of things, which we'll maybe touch on later. But really, we are trying to restore a sense of balance and alignment throughout the body. We definitely would say we are spine specialists, but any joint of the body, the muscles, the nervous system around that area, they're all things that we focus on restoring that balance to. Uh, you know, as chiros, we will train up to a master's degree before we can practice. Compare that to a physio. Physios will generally start working from a bachelor's degree and sometimes even to an honors degree as a comparison. I'm not entirely sure what TCM, their graduation level is, but again, they have their own colleges and things that they work on. But when you are comparing chiros versus physio versus TCM, now obviously I'm not TCM, I'm not a physio, so I'm not going to try and be able to give true credit to everything they do. But definitely from my experience of working with physios, they're really very good at the rehab. We hear a lot about them working with post-surgery rehabilitation, and that's really an amazing thing that they are experts at. With TCM, TCM is obviously now working more with traditional Eastern medicine, where it's talking about energy flowing through the body, internal medicine, utilizing the cupping, the acupuncture, tuina, gua sha, all these amazing things that work. And they're working on balancing more that type of system. But like I said, when it comes to chiros, really we want people to move, to feel better. And the way we're doing that, it can complement one another. But my responsibility as a chiro is really from a structural perspective, helping the body move, function, and ultimately just feel better.
Right. And as you fairly mentioned, people think about the back cracking.
Hmm.
But what's really happening when you make or when you perform an adjustment? How does it help the body heal or function better?
Sure. It's the famous crack. Everyone sort of immediately thinks of chiros and they think we are cracking bones. Just to put some explanation onto that, the true explanation of that is called a cavitation. Now, I'm not going to try and get into the big explanations of everything, but basically, what we're doing is when we find a restriction in the body, a tightness, something that's feeling like it's maybe not quite positioned correctly or maybe not moving as well as it should. When we apply a chiropractic manipulation to that joint, it's a very controlled, very small movement that can actually cause a loosening of that joint by stretching it, opening it up, and through a certain physical principle, which again, I'm not going to bore you with, that can actually separate that joint, decreasing the pressure within that joint. And when that happens to such a degree, it pulls gas out of the synovial fluid, the liquid that's inside the joint, and it actually creates a little bubble. And that's the sound that it will then make. It will make a popping sound,
Mm-hmm.
you know? So that's really what the crack is. The reality is the crack is not really the be all and end all of what we're trying to achieve. It's just the sound that's made. Really, it's the outcome that we are aiming at. When we apply a chiropractic manipulation, when we are releasing that restriction, when we're releasing that tension, that is what we're trying to do, because muscles and all the soft tissue around that restricted area is going to get tight. It's going to become inflamed. It's going to act in a protective, spastic way. You release that restriction, the muscles can relax, the body can return to some degree of normality, So that's really what we're trying to do by cracking the joint. I always joke and say, you crack an egg, we manipulate the spine. They're not the same thing, But and again, it's again the videos, the YouTube clips. We tend to see the neck, the back, but any joint, shoulder, knee, ankle, pretty much any joint, we can sort of get some movement restored into that area, which is then often associated with some sort of an audible sound.
Okay. And then basically for someone who's experiencing, say, back or neck pain,
Mm.
um, so say for myself, when do I make the decision? When should I see a chiropractor? When should I see a physio? When should I go to a TCM? Are these situations like unique? Are there unique situations where you see either one, or do they all, or are there places where they complement each other?
It's a great question. One I get asked a lot. Uh, a very simple answer is it depends on what you are looking for and what you are hoping for. Because each profession has its strengths, each profession has its focuses, and it depends on what you're hoping to get out of your therapy, your treatment. It's going to help you determine which way you want to go. It does help if you've had some sort of physical therapy before. Anytime I meet a new patient, I ask them, okay, what have you done? Who have you seen? Have you done just a bit of massage? Have you been to a chiropractor before? Have you had the TCM, bone setting, a bit of gua sha, acupuncture? Chiros, we do something called dry needling. It gives me some sort of direction of which to flow in terms of how can I help this patient. If you come in and you say, you know what, Warren, I've gone for so many massages and it really doesn't help. Well, then I know that my treatment has to look at something other than soft tissue. Because if you're doing only soft tissue all this time, I've got to look at maybe the alignment is not right. If you've only been getting manipulation, but that's all you've got, well, then maybe something is missing. Maybe we need to look at the rehab. Maybe your core isn't working correctly. Maybe I need to try a little bit of dry needling. So it really is about hearing what the patient has, what they've done, and then trying to bring that all together and like, what's my goal? What's my hope? What do I want to achieve? And then I try to send it that way. Again, like I said, chiros, we're going to look at balancing the body. Physios, I would tend to send them a lot more for the rehab. We have physios in our clinic. So when I feel like they need a rehab centered thing, I'll often get one of my physio colleagues to help me out with that, and really take it from there. But the reality is, I've had many instances where a patient's come in, we've talked through their problem, and something stood out. And I've said, okay, do you know what? I don't think this is me. I don't think I'm the best person to help you with this. Right. And depending on what I hear, sometimes it's, do you know what? You need to go see a doctor, a GP. This sounds something internal. It sounds like something that you need. The same thing is, when do I go for an MRI? When do I go for a scan? It's the same thing. Sometimes you're hearing information, and in something in their history just makes you think, we're not got the full picture. We need to get either somebody else's eyes looking at this, or we need to scan, or I'm just really not the right person for this. And then we think, I work as a problem solver. You know, chiropractic is just the sort of the tool I use to problem solve people's lives. You know, and when my toolbox is not sufficient, I'm very grateful that I've been in this profession for so long that I know a lot of people where I can say, I'm going to send you to so and so. I'm going to send you to such and such,
Right.
because that's the person I think is going to give you what you actually need. So yeah, it's a little bit of a unclear, imperfect way of answering the question. But the reality is each person is different and each person needs something a little bit different. And we
Mhm.
can only really know that when face to face, talking through it, hands on, examining, and then we can make a better judgment call on that pathway.
Right. And well, basically now you've got the opportunity here. I mean, are there any myths or things that you've heard about chiropractic care that you want to debunk? What's your biggest pet peeve when you hear about um, you know, what people say about chiropractic care?
I smile because I hear so many. Um, Look, I think the biggest myth that I hear from a lot of people is that chiropractic is dangerous.
Mm.
You're the guy who breaks bones, eh? That's the one I hear a lot. I said, no, I don't break any bones. So it's that uncertainty of, we hear a sound. The sound sounds like something's breaking in half. Oh my gosh, am I still alive? You know, the reality is, if I were to break someone, I wouldn't be in my position for very long. You know, chiropractic is a medical degree. It's not something that you can just pick up over a weekend. It's a 6-year degree. It's a master's degree. There's a lot of checks and balances, a lot of stuff we got to do to determine, is it right for me to adjust you?
Hmm.
Is there anything, we call them red flags? Is there something that sticks out and like, I mustn't work on this person, you know? So it's that fear that we're just going to go on it. Unfortunately, and this I say a lot to my patients, the era of social media kind of has hurt us a little bit, because people don't want to click on the mundane, boring day-to-day therapy. They want the thing that's going to make the big noise and the big lady screaming, and it's kind of a bit shocking. But the reality is that's far from what we do, far from what I see on a day-to-day basis. So it's this understanding that we are very safe. We had there was news a while ago about Thai massage that had actually resulted in a few people dying.
Yeah.
I can't remember the exact number, but from that point, we had a huge number of people who suddenly became very anxious because they thought, oh, and I had to keep reminding them, okay, you've got a Thai massage therapist who just does Thai massage, and they've been shown to twist someone's neck until it goes pop. But that's all. You've got someone like me who trained for 6 years, who's got 20 years clinical experience, who's caught cancers and all these other things. I treat babies all the way to grandparents and everything in between.
Hmm.
It's very safe. And that's the biggest myth that I really wanted to debunk, is this concern that, am I okay? Or am I gonna be paralyzed? So it's quite, yeah, that's the one I would say is the biggest.
Well, I mean, to be fair, that's the one that I hear most as well. So yeah, it's definitely that big one. Um, if you talk about pain relief, so probably one of my last questions, maybe. So beyond pain relief, where does chiropractic care come into long-term benefits as well as say how does it fit that broader approach of wellness for an individual?
Sure. Pain relief is going to get people in the door. People, they first come to see me because my neck hurts, my back hurts. That's why they're going to come see me. But it's through the evaluation, through the discussion, through understanding how they are, that I hope to lead them down this pathway of like you said, wellness. Okay. Chiropractic, as I mentioned, it's all about helping the body move better, function better, perform better over the long term, not just in the short period. Okay, I'm sore, I want to feel less sore. So, yes, we do have to help people understand that there is a process involved. You know, um, I'm a simple guy. I like simple analogies, and so I always use this one, the analogy of a car. So when you have a car, you know that you have to take your car into the mechanic once a year or once every 15,000 kilometers for a service. Why do you do that? You do that because the cost of a service is significantly cheaper than if you leave it and the engine explodes
Right.
and now you have to replace the engine. In this analogy, we as people, we are the car. And if we do not help ourselves to maintain, run efficiently, something big is going to happen where, I'm sorry to say, it's where we end up thinking of having to go for surgery.
Mhm.
It's the regular checkups that are going to prevent or help to prevent the little problems becoming a big problem. A well-aligned body moves more efficiently. There's less wear and tear on the back, on the knees, on the shoulders. And with regular care, we're coming up to High Rocks in the next couple of weeks. We've got the Standard Chartered Marathon coming up in the not too distant future. When you're getting regular care, your body recovers quicker. So the injuries of training and the tiredness from training recovers so much quicker. So, it's not just for high-end athletes, it's for the weekend warriors, it's for the people just trying to get a little bit fit. It's even for people who unfortunately are stuck in this position, sitting at a desk all day, rounded shoulders, neck tense because they're on the computer fighting all day. All that sort of stuff. We want to try and help them get their body feeling better. There is a very, very clear connection between the mind and the body. We talk about the psychosomatic reactions and responses. And we know that if you are sore, if you are achy, if you are tired, you are at a greater risk of feeling tired. You are depressed. You are more anxious. You are more prone to outbursts and all the rest. So if we are keeping your body feeling relaxed, calm, not so sore, everything else just that much easier. So as much as I said, pain is the starting point. It's the starting point to a journey. And that's really one of my biggest encouragements to people is please don't just look at this that, okay, when my neck pain feels better, that's the end of the road. It's not. It's the start of an amazing journey that you are going to take part in. And I look forward to helping people do things like that.
Right. Thank you very much, Warren. The truth is, I think I relate to a lot of what you've said because, yeah, uh, working at a desk for many, many hours, and I feel like my posture's gone uh, to some place where it's not supposed to be, and it's not really the best thing. And I think it really helped to enlighten, well, at least me myself a little bit more about what chiropractic care is about because I've had the same questions in my head as well. And it was only after I came to you for treatment, and that's when I went, oh, okay, I kind of understand it. I don't fully get it, but it's just been one session. Probably be heading down for more. But with that, once again, Warren, thank you so much for joining us today.
Thank
And
you so much for having
yeah,
me.
for sharing. Thank you.